Hello doctors, back again with another quick tip. Today we're discussing how to tackle any scenario where your patient presents with pain as the primary presenting complaint. So I want you to keep in mind, whenever a patient presents with pain, the Socrates mnemonic. Okay, this is a simple and effective framework in order for you to get an accurate and detailed history about the pain. So let's run through the mnemonic letter by letter. So the S is going to be for the site. So this is where you'd ask the patient to identify and localize the pain. So ideally you should ask them to point to the pain so that you can get a much more accurate understanding of where the pain is. Then moving on to O, you want to ask them about the onset. Has the pain been a gradually onsetting pain, or is it a sudden onset pain? Moving on to C for character. So ask the patient the type of pain that they're experiencing. So offer them different types of pain so that they can identify the type they're experiencing. For example, sharp pains, dull pains, throbbing pains. Moving on to R for any radiation. So does the pain happen to spread anywhere? For example, if a patient has chest pain, does it radiate to their arm or to their jaw? Moving on to A for associated symptoms. So for example, with headaches, patients tend to have headache and they can experience nausea or vomiting. So you want to try and identify any associated symptoms, if there are any, that patients have been experiencing alongside the pain. Moving on to T. T is for time. So you want to gauge when this pain has begun. And also at what time of the day. Moving on to E, we want to identify any exacerbating or alleviating factors. So these are factors which can improve or worsen the pain. And lastly, we want to score the severity of the pain. So you ask your patient that can they please score the pain 1 to 10, 10 being the worst pain they felt and 1 being no pain at all. So guys, please remember to keep this framework in mind whenever you approach a pain case. And just remember that Socrates is not an entire history, it only forms part of a history. So to get a complete history, you still need to explore all the symptoms, the past medical history, the family history, any medication history, etc., as well as the social history. And all of this combined with Socrates can help you get a diagnosis. But for pain, don't forget Socrates.